Hello, and welcome to From the EBPL Archives, Encore presentations from the East Brunswick Public Library. I am your host, Melissa Hosick. This event was presented as part of our Just for the Health of It initiative. Just for the Health of It is a proprietary health literacy program developed by the East Brunswick Public Library to promote health literacy in Middlesex County. To learn more, visit justforthehealthofit.org. Now, enjoy the program.
Welcome, and thank you for joining us this afternoon. My name is Kathy Churn, and I am a consumer health librarian at East Brunswick Public Library. This program is brought to you by the library's Just for the Health of It initiative to promote community health and wellness. Today's speaker is Mike Salem, Medicare consultant and advisor. And before I turn things over to today's speaker, I would like to ask you to please mute your microphone and turn off your video. Please be aware that this talk is being recorded and will be posted online at the library's YouTube page at ebpl.org/YouTube. And without further ado, I shall turn things over to Mike.
Thank you, Kathy. Once again, it's nice to see you. Hello, folks. My name is Michael Salem. And as Kathy says, I am a consultant for Medicare and Medicare services. And what I'd like to provide for folks is any information or questions that they might have. It's basically an educational format that I do. And then later on, if you guys have any questions, please feel free to take my information down, my phone number and my email address, and I will be more than happy to help you with that. Okay. So I've been in corporate America, just a little bit about myself. I've been in corporate America for over 35 years. I was a floor manager for a major Wall Street firm. For the clerical staff, I did lose my job back in 2008, although I lasted to 2013. And then I started doing this. And I realized I started doing insurance, but then I realized a lot of people had no idea what's going on with Medicare. So I was fortunate enough to deal with a gentleman that knew about Medicare, and we worked together, and now I branched out for myself. Okay, and like I was saying, my top priority is to reduce the stress for folks as far as Medicare goes, and to basically educate folks on Medicare. I'll give you an overview of what's the choices available, and I can make recommendations as an individual. Because one thing about Medicare is very individualized. What works for me might not work for you or might not work for the next person. Okay, especially when it comes to the RX products, and I will be getting into all that. Now, as I was saying, I educate, I provide options with different insurers on the market, and I do assist in enrollment. I will let you know about Medicare's Part A, B, the Medigap plans, Medicare Advantage plans, and the most important, basically, of all is that RX plan. Okay, I will be getting into that a little bit later on. That's going to be the third section. So Section 1 will be Medicare and Medicare supplements. As you can see, Section 2 will be Medicare Part D, the prescription plans, and then the Section 3 is the top 5 mistakes that people make while on Medicare. All right, first, Part A of Medicare. Part A of Medicare is really hospital insurance. So anything that's going to happen within the hospital is covered under your Part A. Okay. So any skilled nursing care, any rehab facilities, things like that, hospice, all will be covered under the Part A of Medicare. Okay. The Part B of Medicare. Part B of Medicare, well, one step back, I apologize. The Part A, there's usually no premiums for Part A. Once you work, you've worked in the country and paid your taxes for 10 years or 40 quarters, then you're eligible for your Part A at no cost. You can get Part A at a cost, but it's about $450 a month, and that's just the Part A, okay? Part B is the medical portion of Medicare. That means that it's anything outside of the hospital. For instance, your doctor, any testing that the doctor might send you to, any durable medical equipment, okay, any blood work, all that stuff that the doctor would send you, that is covered under the Part B. Now, there usually is a cost for Part B. I will be going over that in a couple of slides. And it's income adjusted. It's income related, depending on what your income is. Skipping over the Part C, we're going to go to Part D because really Parts A, Part B, and Part D go together. Okay. The Part D is your prescription drug coverage. The Part D it helps cover your prescription costs. It's basically a plan that you would get in order for your medications. Now, the way this works, and again, I will be going over in depth in a little while later, the Part D of the prescription drug coverage it has to do with the actual medications. And this is where it really becomes an individualized portion because we all take different medications, different dosages. There is a way that we can find out which plan actually works. The plans usually do have a premium. It could be a $13 plan or a $10 plan. It could be a $100 plan, $130 plan, depending on what your medications are. Now, the Part C of Medicare, okay, it's basically a misnomer, the Part C, because it's really not a part of Medicare. Part C is really a Medicare Advantage plan. What a Medicare Advantage does is it actually takes the place of Parts A and B of Medicare, okay? It's individualized, and it's basically run by an insurance company, whether it would be an Aetna, United Healthcare, or Clover, or somebody like that. But they manage your Medicare, your healthcare, whereas Part A and B, Medicare manages your healthcare. Okay, so the Part C, whichever insurer you choose, that's the one that's going to cover or it's going to regulate what you need to do. If you folks are familiar with an HMO or a PPO, that's what it is. Okay, and again, we'll go over that once again in a little more in depth in the next slides. Some of these plans vary by prices. Maybe some might have zero premiums and some might cost you more, okay? As I said, the Part B of Medicare is income related. As you can see, these are the 2019 pricing. So we can skip over to the next slide. We'll just go straight to the 2020 pricing. Okay, so the Part B is regulated by IRMA, which is it's the income-related monthly adjustment amount according to what you earned, and this is what you earned 2 years prior to the year that you'll be working on. For instance, 2020's income tiers is regulated by 2018's taxes, okay? Because the 2019 taxes are not on file yet, so they won't know. The 2019 taxes will regulate for 2021, okay? So an individual earning, if it's an individual filing in the individual, one person, if you earned under $87,000 a year, as you can see on the field there, your premium for the Part B is going to be $144.60. If you're a joint filer, a married couple, and you earn under $174,000, then your premium will also be the $144. That's when most Americans fall under that category. As you can see from on the second tier, if you go from $87,001 to $109,000, or $174,001 to $218,000, then your Part B premium is $202.40. Okay. Now the premium is what they look for in the on your taxes is what's called the MAGI, or the modified adjusted gross income. The adjusted gross income has some, and I'm sorry, I'm not a tax guy or an accountant, so I'm really not sure about that stuff. But the modified adjusted gross income, the adjusted gross income has certain levels or certain things that are deducted from. The modified adjusted gross income, certain things go back into it. Okay, and then at that point in time, that's when they'll figure out what your premium will be for the Part B. It's not your overall or exact amount. It's the modified adjusted gross income. Okay, and as you can see, it goes straight down the line from 100 and up to under $500,000 or over 750,000. Then you're looking at almost $500 for that Part B premium. Okay, this also works for your Part D. Okay, the Part D premium is the exact same formula for your monthly or for your yearly income, and it will work 2 years prior on the tax returns. But what they do with this in this situation is, remember I told you there's a plan premium, could be $10, could be $100. If you're under the 87,000 mark or under the 172,000 mark as a joint filer, then you're going to be paying exactly what that plan premium is. Okay, so if it's that $10 plan, that's all you're going to pay is $10. If you earn more than those figures that I just mentioned, as you can see in section or tier 2, they will add that $10 for that premium plan, and then they'll add $12.20 to that. So your cost would be $22.20, and so on down the line to where you get in tier 6, you're adding the $10 plus, or the $10 for the premium plan, the plan premium, and $76.40. Okay. Once again, this might be a lot to absorb. So if you folks, you can kindly, again, take my number down, take my email. You can answer all the questions, or, save the questions for later. We'll discuss this more in depth. This is the total of the Part B premium along with the RX premiums. So in tier 1, you're not paying anything additional, so it's $144.60. In tier 2, it's a combination of the $12.20 plus the $208. So you're looking at $214.60, and so on down the line. So when you get to tier 6, you're looking at $568. That's the $71 plus the additional monies that the tier 6 required for the Part B premium. So net total for both, you're looking at $568. Okay. Now let's get into the number one mistake that people make when it comes to Medicare supplement plans. Okay, or Medicare itself, excuse me. The number one mistake that people make is that they don't enroll in Medicare when they're eligible for it, or when they should enroll. Okay. Medicare, there's a 7-month initial enrollment period, or IEP as it's called, okay, which is when you turn 65, that month, your birth month, 3 months before and 3 months after, that's your 7-month enrollment period, okay? Depending on what you do, if you're going to continue working or you're not going to continue working, if you're going to stop working and you're going to retire at age 65 and you're going to need Medicare, it's crucial to enroll during this period. You don't have to, but it'd be crucial if you're going to, and you're going to need Medicare. Okay, and I'll show you why. What happens is if you don't enroll in Medicare when you're supposed to enroll, and you don't have credible coverage, and I'll explain what credible coverage is in a little bit, you will be penalized 10% of your premium, of your Part B premium, for every year that you have the Part B premium, and it never goes away. So if you waited 3 years, now you're looking at 30% increase. So that $144 for that Part B premium, if you waited 1 year, add another $14 to that. So now you're looking at $158, and so on down the line. And again, it doesnn't go away. It's going to be with you for life. And that also applies to the IRMA for the RX plans also. Okay, so it's very critical that people, enroll in Medicare when they're supposed to enroll. Okay, and as you can see on the example, the IEP example, so if you were born, let's say September 10th, you can start your enrollment on June 1st, and you will get your Medicare Part B and Medicare Part A. It'll start on September 1st, which is the day of your eligibility. So no matter what day you were born in September, your eligibility day will be the first of that month. Okay, and then you have until December 31st to enroll with no initial or with no penalty. Now here's where it gets a little tricky. During your initial enrollment, when Part B begins, if you sign up during the first 3 months before your 65th birthday, you're going to get your Part B premium on your birth month. Okay, you'll be covered on the first day of your birth month. If you do it during your birth month, then you'll be eligible for the first of the following month. It won't be on your birth month, but the next month you'll get it. Now, if you do it on the month after, or the first, second, or third months after your birth month, then you got a waiting period. Okay, why they do this, I don't know, but this is the policies that Medicare has. During the birth month, after your birthday month, then you have to wait 2 months prior to that month. So if you're in September, now you're in October, you're not going to be eligible until December. okay? And as you can see, if you wait till the third month, so if you're in September, it was October, November, December, now you got to wait 3 additional months after your birth month. So if you apply in December and you're a September birthday, now you're looking at January, February, March. You're not going to get until March 1st, okay? And there's another thing. If you go past these months, they force you to wait. So let's say you go in after April 31st. And this is a very critical, and this is why we're saying this is the number one mistake that people make as far as with Medicare. But if you go past December 31st, that third month, and you go into Medicare, you don't have any coverage, okay? What happens is, if you go in April 31st, they make you wait until July 1st they make you wait until January 1st for the following year. So if you go, let's say May 1st, and you look for your birthday was in September, you go in May 1st, they're telling you, no, your open enrollment is going to be January 1st. So you got to go now you got to wait all the way around to January 1st. You go in January 1st or 2nd, whatever it is, you got from January 1st to April 31st. That's your open enrollment when you miss your cutoff or when you miss your initial enrollment period. So once you wait, you got to go, you go in January 2nd, you enroll for your Medicare Part B. Guess what? The first day of eligibility is July 1st. So now you went from May all the way to the following year. So, what's that? For almost 12, almost 16 months without medical coverage. So this is why we say this is the number one mistake people make. Okay, not enrolling when you do. All right. Another mistake that people might make is who pays first? When do you need the Medicare coverage? Okay. If you become eligible at age 65, but you work for an employer that has less than 20 employees, you have to get Medicare on your birth month. Medicare becomes primary. So you would have to get Medicare if you're under 20 employees, if your employer has under 20 employees. If you're age 65 and you're on a group or plan or spouse's group plan, and your employer has more than 20 employees, you can keep that group health plan and not have to worry about it. That group health plan, when you guys heard me before mention credible coverage, that group health plan has credible coverage. That is your credible coverage. So you don't need to get Medicare at that point. Okay? And it's very critical not to get your Part B, and I'll explain why later at that point. You want to get A comes in, it doesn't matter, you're not paying for it, you don't have to use it, it's okay. But the Part B is the critical one, and I'll explain why in a little bit, okay? Now, if you're on disability and you were covered under a group plan or a spouse's plan, and the employer has under 100 employees, then just like the top scenario, Medicare becomes the primary, and you would have to get Medicare at that point, okay? And subsequently, if your employer if you're disabled and the employer is over 100, then you can keep that group coverage, okay? If you're on an employer retirement plan, they want you to get Medicare. So once you're eligible 65, you're going to have to get Medicare. If you are retiring, even if you're past 65 and you're retiring, you're going to have to get Medicare. They're going to want you to get Medicare because Medicare is going to pay most of the portion of their coverage, and then they'll pick, if they give you a retirement plan, then they'll pick up the balance at that point. Okay. All right. So Part B enrollment scenarios. By the way, if you guys have any questions, please write it down and we will discuss it at the end. Or like I said, you can feel free to give me a call and we can discuss it personally over the phone, no meeting, face-to-face. We can everything could be done over the phone personally. All right. And I don't charge anything for consultations. All right. Everything will be free consultations. Okay. So now Part B enrollment scenarios, turning 65. If you are already in collecting your Social Security benefits, you will be automatically enrolled in Parts A and B. Now, this is something that you have to be careful, because some people are collecting, if they collect their Social Security and you enroll in and they automatically enroll you in parts A and B. And this is critical. You must send back the B portion. Do not get the B portion if you're going to continue to get if you have a group coverage. So let me restate that. If you turn 65, you have your Social Security, you're collecting Social Security, you're going to be automatically enrolled in A and B, but you are still working. It is critical to return the Part B portion of Medicare. Okay, and I'll tell you why real quick, and I'll be more in depth in a little while. But anyway, what happens is that once you get that Part B, you have a 6-month open window in order to pick up whether you want a Medicare Advantage plan or a Medicare Supplement plan, with no questions asked. Once you pass that 6-month period and you were to try and get one of those plans, with a Medicare Advantage, you would either have to wait for open enrollment between October 15th and December 7th, or with a Medicare Supplement plan, if you were to go for that product, you would have to undergo medical questioning, and if there's certain things that you might have, you won't be, you might be turned down. You can't be turned down. Okay, with the open enrollment, the 6-month, there's no questions asked. You will be automatically enrolled with the Part B. So it's critical. If you're going to continue working and you have your credible coverage, return to Part B. Okay, if you're turning 65, the next scenario, if you're turning 65, you're not enrolled in Social Security, so you're going to have to auto-enroll in that yourself. If you're going to stop working, you're going to lose your group coverage, or again, if your employer's under 20 employees, you're going to have to enroll in Medicare. You can go onto the website right there that I'm showing you, secure.ssa.gov, and you can enroll through Medicare Medicare, and it's very easy, very simple, and it's quick. I'd like to further elaborate a little bit on this. If you are collecting your Social Security benefit, the Part B benefit is paid by your Social Security. Okay, so regardless of which it is, it's going to be taken out of your Social Security. That's on a monthly basis. If you're not collecting Social Security, if you elect to wait on Social Security, but you want to get your Part B coverage, then you will be billed quarterly. Medicare will bill you quarterly for your Part B premium if you don't collect your Social Security. Okay? Now, the last scenario there is enrolling after age 65. You're past the age 65, you're currently continuing to work, you have credible coverage through your employer, and now you decide to retire at age whatever, 70, whatever, you decide to retire. Now you need what's called the CMS forms, which is the Center for Medicare and Medicaid Services forms, okay? This is the forms that you need. Now remember I told you guys that if you didn't have credible coverage, and once your initial enrollment period was passed, and you passed that certain time period, and you will be penalized 10%. Well, if you decided to work, these are the 2 forms that you would need. Now you can either call me up, I will email it to you, or send them to you, or mail it to you, whatever you like. But these forms are critical not to be charged the 10%. If you look online on those websites that I've given you there, you can go on those websites and you can get it from you can download it. Okay, now one form, the one on the left, that form is to be filled out by yourself. Okay, that's just giving them your Social Security number, your information. The other form, the L564E on the right hand side there, that form needs to be filled out by the employer. Okay, that form is going to tell Medicare that you've had credible coverage up until, if you look at lines 5, the middle line there, it'll tell them that you were employed for whatever day. It'll also tell them when you're planning to be employed and when you're going to have coverage up until. Okay, we strongly suggest, you could do this the day before you retire. So if you're going to retire July 1st, you can bring it up on June 29th or June 30th. You can bring these forms. but you're not going to get anything. And it's going to take at least a month before you get all the paperwork and everything in. You'll be eligible. They'll give it to you your eligibility for July 1st, but you're not going to, like I said, the IDs and everything else is just going to take time to get involved or sent to you. What I strongly suggest is, if you're going to do this, if you're planning on retiring, then get this done. My personal preference with folks is to do it 3 months prior, 2 months prior. You can do 2 months. That's not a problem. It'll get done. And you'll have, when July 1st comes around, you're going to have all your ducks in a row and everything will be settled. But those forms are critical, because these forms are the ones that are going to tell Medicare that you had credible coverage for all the years or all the time since you were eligible for Medicare at age 65. And then you're not going to get penalized for 10%. Okay, once again, you have my contact information. You can call me. I'll be more than happy to send it to you. I'll be more than happy to email it to you, whatever you like. Okay, let's go into Medicare choices now at a glance. So you folks know, hopefully you guys are aware, what happens with Medicare. Medicare generally covers like 80% of a hospitalization, and I'll show you the chart where what the actual breakdown of what Medicare charges at that point. But Medicare Parts A and B cover only 80% of any hospitalization, any kind of doctor visits, hospice, things like that. And I'll show you that breakdown in a few. There's only 2 roads that you can take when you're when you go on Medicare and then you want something to cover that 20%. Okay, there's only 2 avenues. So Part A, Part B, and Part D is, you would have to pick up a Medicare supplement, or you can get a Medicare supplement if you like, okay, or what's called a Medigap policy. I'm going to go more in depth in the next couple of slides of what a Medigap policy is. Okay, well, I want to stop in a Medicare Advantage, and I don't really have many slides on the Medicare Advantage, the Part C, or the HMO or PPO or Medicare Advantage. And the only reason is because it's, like I told you before, it's a very individualized program. And although it's mostly very similar, the CMS and the government do put restrictions on these plans for the individual insurers to have the same basic coverages, but they aren't different. Okay, they do vary slightly in these plans. So what happens is, most of these plans, they could be 0 premium, so you're not going to get charged anything for the plans, okay? Whereas with a Medicare supplement plan, they do have a monthly premium, okay? But with the Part C or the Medicare Advantage plan, since it is an HMO and a PPO, what happens with these plans is, if you were to spend any time in the hospital, okay, you can have as much as $6,700 in out-of-pocket expenses, okay, with these plans. If you had a PPO, which allows you, let me backtrack on that. HMO is you're limited to the doctors that you go to, because you have to go to their doctors, you have to go to their network. Could be county-wide in some cases, could be statewide in some cases. There are some insurers out there that you can actually get. They do have a nationwide network that you can visit. You would have to find out in advance if you're going somewhere, and you want to find out if they have doctors, and just in case, God forbid, something happens, you can talk to them at that point. There's just a couple of companies that would have nationwide coverage. I know Aetna, for one, that definitely does. A PPO, okay, with a PPO, I'm sorry, generally the HMOs, it's more of a state plan, it's a statewide plan. So they'll cover you in the state. So let's say you're obviously you're living in New Jersey. If you move out to Pennsylvania or Maryland or somewhere, or anywhere in the United States, once you go out of your coverage zone, you have to get another Medicare Advantage plan. Okay, you have to pick up another plan at that point. Okay, and you do have a safeguard, and I'll show you later. You do have a safeguard that you can pick up another plan at that when you move. Okay, with a PPO, even though PPO, if you move, you still have to pick up another plan in that coverage zone. But what a PPO allows you to do is to go outside of the insurer's network of doctors and hospitals, so that you can go. So, for instance, I know for a fact that Sloan Kettering, Hospital for Special Surgery, hospitals like that do not take HMO plans. They'll take the PPO, and then the hospital will have to abide, or not abide, but they'll have to, they will find out if the PPO works for them, and then they'll accept it at that point. But the out-of-pocket expense at that point can be as much as $10,000 if going into a hospital. So if you were going to go to a Sloan Kettering and you had an HMO or Medicare Advantage, an HMO, it's not gonna work. With a PPO, they'll accept it, but you're gonna have a higher out-of-pocket expense, okay, with this plan. A lot of times with the Medicare Advantage plans, most plans do usually cover the Part D, your Medicare RX plans. So it's all built into one. Again, it's a privatized plan. It works through an insurer, whether it's an Aetna or United Healthcare or Transamerica or Clover, whoever it is, but they will take over your healthcare at that point, okay? With a Medicare supplement plan, you can go to any doctor, any hospital in the United States. 98% of hospitals take Medicare. And remember this, Medicare is your primary. If you're staying on original Medicare, you do not go with a Medicare Advantage. You're staying on original Medicare. Medicare is your primary. No matter what hospital, 98% of them take Medicare, or doctor, 90% of doctors take Medicare. They're going to accept the plan. And since the Medicare supplement, it's exactly what the word means, it supplements original Medicare, the doctor or hospital will go along with whatever supplement plan you have, because Medicare, again, is the primary, okay? And that's called a Medigap policy, Med Sub policy, things like that. Okay, Kathy, next slide. Okay, so now, this is the number 3. I didn't forget about number 2. This is the number 3 mistake that people make when it comes to Medicare and its products. Is not really getting the perfect or the right plan for you, okay? If you had a Medicare, if just comparing, now just remember this, folks. This plan or Medicare is going to be the coverage for the rest of your life. Could quite possibly be the coverage for the rest of your life. God forbid you go on the Medicare, you're going to Medicare Advantage plan, and then you say, you know what, this isn't for me. I'm going to go to a Medicare supplement plan. And now, but you develop cancer or whatever, whatever it is, God forbid, they're not going to accept you. You're going to have a waiting period if you had cancer, probably about 3 to 4 years, depending on the insurer themselves. So, and if you get certain things, Parkinson's, whatever the case is, they're not going to accept you. So you're going to have to stay with the Medicare Advantage plan, okay? A Medicare Advantage plans can drop. They can leave areas. So if you're in an area that that has a certain Advantage plan, or you have a plan that's in a certain area, and they decide to leave, then you're going to have to get another plan. Okay. So with original Medicare, they can't do that. It's guaranteed renewable for life. Okay. So let's just go over the 2. So just to reiterate, this is the most important decision you're going to make when you reach the age of 65, and when you're going to come into your Medicare, and you're going to take your Medicare. So getting the right coverage at the right time, or at the right time, because at that 6-month period, there's no questions asked at all, is critical. You should make the best informed decision for you. Okay. Now, Medicare characteristics, okay, of the individual plans. Now, whether it's original Medicare compared to a Medicare Advantage plan. The relationships between Medicare Parts A and B, Medicare Advantage replaces it, as I said. It privatizes the plans. So it replaces that. If you're not on original Medicare anymore, you're under the insurer's coverage. Original Medicare and a Medicare supplement plan. The supplement plan supplements original Medicare, so it works directly with it. Medicare is primary. Is there a private network required on most Medicare Advantage plans? Yes, there is. Original Medicare, no, there is not. Any doctor or any hospital, as I mentioned before, 90% of doctors, 98% of hospitals will take it, so there is no question asked. Are referrals required on some plans of an Advantage? Yes, they are. On original Medicare, no. You go wherever you want, whenever you want. Is Part D included on most plans of an Advantage? Yes, it is. On original Medicare, no, you have to pick that up separately, and it will be an additional cost. Monthly premiums, yes, they do vary. On a Medicare Advantage, could be zero. I've seen some as much as $100, $130, $140 in some cases. In original Medicare, with a Medicare supplement, yes, they vary, but they are generally higher. And if you look at the next line, it's the annual out-of-pocket costs. It's a Medicare Advantage is up to, you can, as much as $6,700. A PPO could be as much as $10,000. Okay, so whereas with original Medicare and a Medicare supplement, you're saying, but I'm paying a monthly premium, but yet you're telling me that my out-of-pocket, my annual out-of-pocket cost is minimal. Right, because if you buy a plan, let's say a plan G for $130 a month, you're looking at $1,500, $1,600 roughly for the year. But that's all you're going to spend. And then you're going to have to pay the Part B premium, which is another $198. So if it's $1,600 and another $200 on top of that, you're looking at $1,800. That's all you're going to spend on any kind of hospitalization, any kind of surgeries, anything. Okay, that's why we say it's minimal for original Medicare with a supplement plan versus the annual out-of-pocket costs of on an Advantage plan. With some of these Advantage plans, if you go into the hospital, it could be anywhere from $250 per day to as much as $500 per day. I've seen in some of these plans. So if it's $250, they're going to make you pay that for 5 days. If it's $500, they're going to make you pay that for 2 or 3 days. So regardless, every time you walk into a hospital, and if it's twice a month, and it's 2 different scenarios, you're going to have to pay the $250 for the 5 days, or the $300 or the $500, whatever it is. You're going to have to come up with that. And they do have change. They do have, as far as like X-rays and all that, you're going to have a copay to go along with that. Ambulance, you're going to have a copay. Blood work, you're going to have a copay. Deductibles, things like that. It's again as much as $6,700. Okay. Are the plans guaranteed renewable for life? As I mentioned before, a Medicare Advantage, no, it is not. If you move, you have to get a plan. The plan can leave. Between October 15th and December 7th, you do need to recheck your plan and make sure that it's suitable for you. Once again, with original Medicare, it is guaranteed renewable for life. The supplement plan will never once you pick up a supplement plan, you'll keep that for forever. As long as you can't lose it. The only way you can lose it is you don't pay your monthly premium. And they do give you a good 30 days. They give you a 30-day check to make sure that they let you know. And then 30 days after that is when generally they'll probably cancel. So they'll give you 2 or 3 months before they actually cancel your plan. But again, that's the only way you can lose it. No matter, regardless of what's going on, health-wise, you're never going to lose a Medicare supplement plan. Okay. Now, going into Medicare supplement plans, and like I said, I don't have too many plans as far as the Advantage plans, is because it does vary. But keep that in mind about the high cost and everything else, so the high deductible and all that, even though the plans are zero premium. Okay. I'm going to get into the 3 main plans. Well, actually 2 now. The 2 main plans of Medicare, but I am going to review the 3. You have the main plans for Medicare supplements is Plan F, Plan G, and Plan N. Plan F, back in 2017, we sold about 7% of these products. The G, we sold 77% of the products, and the Plan N, we sold about 8% of the products. And I'll obviously I will let you know why that is. Real quick, I like to put this up here so that people will know. No matter which plan you choose, whether it's an F, G, or an N, okay, they are a standardized plan. It's a standardized. The plan is federal and state regulated. So a plan N or a plan G is a plan G, no matter which insurer you have. It could, whether it's Aetna, Transamerica, Mutual of Omaha, Cigna, it doesn't matter. A plan G is a plan G. Okay. If you look down here, it says each standardized Medigap policy must offer the same basic benefits, no matter which insurance company sells it. Cost is usually the only difference between Medigap policies with the same letter designation sold by different insurance companies, okay? And then the next line, it says the cost of Medigap policies can vary widely. There can be big differences in the premiums that different insurance companies charge for exactly the same coverage, okay? It sounds terrible, but it's like buying gasoline, you know? If you buy, you can go to 5 different gas stations for regular unleaded gasoline, and you got 5, it's the same gas, but you can pay 5 different prices. So I tell people, look, just get the best A-rated company that you can get at the least expensive cost. Because it's, you know, a G is a G, an N is an N, an F is an F. It doesn't matter who sells it. So why not get an A-rated company that's going to be the least expensive cost? Okay. Now I told you folks that the plans themselves, what they cover, or what Medicare actually covers, I'm going to point them out to you on this slide here, and you can see what the cost per day on some of these plans. So if you look at it, I'm going to show you the example of a Plan F. Okay. And this is where the variations between the F, the G, and the N, and then I'll show you why the G is the one that we actually sold the most. If you look at a Plan F, the services, so hospitalization, your Part A, the first 60 days. So you're going to the hospital 1 day or 60 days, you're going to come up spending, and this was for 2020, $1,408 comes out of your pocket. Okay. And this is in line with the Medicare Advantage plan. So you'll see the Medicare Advantage plan, you would have to pay out of pocket once you go into the hospital. So it's in line with what Medicare will cover and what Medicare won't cover. So now, the first 60 days comes $1,408 will come out of your pocket. If you stay in longer from day 61 to day 90, Medicare will pay everything except for $352 on a daily basis. So for day 61 to day 90, $352 per day comes out of your pocket, okay? If you go past the 90 days, now you're using the 60 lifetime reserve days that Medicare gives you. With that 60 reserve days, now from day 91 to day 150, $704 is what's not covered by Medicare on a daily basis, so that would come out of your pocket, okay? If you look at what a Medicare supplement plan will pay, or a Plan F, or Plan F, G, and N, please keep in mind that every single Part A, whether it's an F, a G, or an N, every single one for the Part A of Medicare is exactly the same, okay? So the plan will pay the $1,408. The plan will pay the $352 a day. The plan will pay the $704 a day, okay? So you don't have to worry about that, because as you see what on the line, the green line where it says what you pay is zero. You're not paying anything, okay? In addition, Medicare after 150 days does not cover anything. You're out. You're out of luck after 150 days if you're still in the hospital, okay? At day 151, all expenses come out of your pocket. With a Medicare Advantage or Medicare Supplement plan, what they do is they will give you an additional 365 days for any Medicare approved program. So if it's a Medicare approved procedure, you can stay an additional 365 days. So you're going to have 515 days in a hospital. If you have original Medicare with a Medicare supplement plan, you don't pay a dime at all, okay? If you look down at the skilled nursing facility, and again, this is the Part A. So now you get out of the hospital, you have to go to a rehab center. You go to a rehab center, the first 20 days of all approved amounts by Medicare is covered 100% by Medicare. But from day 21 to day 100, Medicare will cover everything but $176 a day. That's what they don't cover. Once again, the plan will pay the $176 a day for the first up to the 100 days. So your cost, zero. For blood, you're collecting blood. The first 3 pints of blood, for whatever reason, Medicare doesn't cover, okay? After that, any additional amounts is covered 100% by Medicare, but the first 3 pints is not, but don't worry about it because the plan pays for it. You don't have to worry about it. Once again, zero on what you pay. And this is your Plan F Part A, or Plan F, G, or N Part A of hospital. Okay, so the supplement plan, you go into a hospital with a supplement plan and original Medicare, you don't spend a dime. Okay, hospice care is covered 100%. All right, by the Part A. Now we're going to go into the Part B of Medicare. This is where it varies from one plan to the next, okay? The Plan F covers 100% of everything. But if you were eligible for Medicare on January 1st of 2020 or thereafter, you can't get a Plan F. That Plan F was taken away, okay? Anybody who was turned 65 was eligible prior to January 1st of this year of 2020 can still purchase a Plan F if they so choose. One thing, I'll skip to that. Now, you know what, I'll tell you. The one reason that we don't recommend the Plan F, since the Plan F has, we only had sold 7% of our policies back in 17. The reason is because the Plan F is very expensive, okay? And as you can see here, all your approved medical services, medical expenses, everything here is covered 100% by the Plan F. The plan, Medicare doesn't, the first $198 is of any kind of hospitalization, any kind of outside of the hospital, any kind of doctor visits, anything that the doctor outside of the hospital is going to send you, the first $198 will be paid out of pocket. Okay, that's a Part B deductible. That Part B deductible, the Plan F covers, so you don't have to worry about it. It covers. It's a great plan, no doubt about it. So you generally, the 20% that's not covered, the Plan F covers it 100%. You don't have to worry anything except for your monthly premium. Okay. First 3 pints of blood, exactly the same thing. Remember, the Part B is anything outside of the hospital, okay? So the Part B deductible, just to reiterate on that, if you go to the doctor, not in the hospital, but your doctor, the very first time in the beginning of the year, whether it's an office visit or a testing he sent you to do, blood work, any kind, maybe some testing, CAT scan, MRI, whatever it is, you will pay the first $198, okay, on a Part B deductible. The Plan F covers it. Let me go, I'll show you the Plan G in a second, because this Part A and B, Plan F, G, and N on this side is the same exact thing, okay? Other benefits not covered by Medicare, any foreign travel that you will go to, Medicare doesn't cover it, but the Medicare supplement plan does, okay? Medicare, as you can see, pays nothing, but for the first, what happens is you have a $50,000 lifetime maximum benefit from the supplement plan, okay? And healthcare outside the United States, it's a lot less expensive than it is here, okay? So that $50,000 does go a long way. So you would have a $250 deductible. All right, and then after that, the plan will pay 80%. Real quick, I know a lady who was in Romania. She spent the whole week in the hospital. She's one of my clients over there. She was having chest pains in Romania. The whole week in the hospital cost her $8,000. She came home, she submitted her bill she has Aetna. She submitted her bill to Aetna, and Aetna paid her back, I think it was about $5,800. So that, just to show you that $50,000 does go a long way. So what you pay is the first $250, and then also 20% of whatever the hospital coverage is, okay? Anything over $50,000, then there's no coverage. As far as that goes. Now, this is an insurance that you can get. It's an insurance that you have if you go outside for an emergency case. If you were to break a leg, then you're covered. But if you were to have a cough somewhere and then you're going to go to a doctor to see, that's not covered. So you have to be careful with that. Even though you have foreign travel insurance, I would recommend that you do get yourself some sort of insurance outside travel insurance, because I do know a case of a lady who broke her leg. The cast and everything else while she was in Europe was covered by Medicare or by the supplement plan, but she had to get a special flight back from Europe, and that was $20,000. And thank God she had travel insurance, so that was paid for by the travel insurance. So if you didn't get your travel insurance, then the $20,000 will come out of your pocket. So be careful with that. Okay. This is going to be the Plan G. And like I was saying before, the Plan G, the only difference between a Plan F and a Plan G is that, as you can see on the green box, what you pay is that first $198, that Part B deductible, that you pay. Now, why did we sell 7% of Plan Fs, only 7% of Plan Fs and 77% of Plan Gs? Because what happens is that the Plan F is so much more expensive than the Plan G that if you do the math, you could spend, in the beginning, it's about $250, $300, but then as the rates increase, as you grow older, you're looking, it could be as much as $500 or $600 more that you can pay for a Plan F versus a Plan G. So what are they doing? They're charging you $500 or $600 more for that Plan F, and the only difference is that they're picking up $198. So I like to tell my clients, listen, take the Plan G, pay less, and pay the $198 out of pocket, but you're still going to save $400, $500 in the long run on a yearly basis. So it's better off for you at that point. Now, as I mentioned, also the Plan N, the difference between the N and the G and the F is that the Plan N now has more products that you would, or more expenses that you will incur, okay, that the plan itself, the supplement plan itself, does not cover. The first $198, again, that you do have to pay. Okay, the Plan N has a deductibles, no more than $20 for doctors and specialist visits, and no more than $50 for an emergency room visit. If you were to go for an emergency room and then stay overnight, now that becomes part of Part A, and you don't have to pay the $50. But if you're in an emergency room, then you have the $50 deductible that you would have to pay. Also, what the Plan N does not cover is what's called the Part B excess charges, as you can see on the bottom of the chart there. That's a figure, that's a number that's anything above a Medicare approved amount, okay? 15% can be passed on to you that the Plan F and the Plan G cover, but the Plan N does not cover. So what happens is, let's say you go to a doctor and the doctor charges Medicare $250 for whatever procedure he just did for you. Well, that $250, Medicare turns around and says, listen, we're only going to pay you $200 for this, okay? Well, the 15% difference can be passed on to you, okay? It will not happen in a hospital. It will only happen outside the hospital because this is a Part B deductible, okay? Why did we sell 30% of our plans as an N? Because the difference between a Plan F and a Plan G, depending on the insurance company, you're looking at anywhere from maybe $20 to $30 a month. So people say, you know what, for $20 or $30 more, I'd rather get the Plan G and not have to worry about this Part B excess charges or a copay, okay? Granted, and I will say this, I have spoken to many people that have Plan Ns, and a lot of people don't even know what the excess charge is, which means that most doctors will just take whatever Medicare gives them, and they'll be fine with that. They'll be happy with that number, and they won't worry. They won't charge the patient anything. They will charge the $198 deductible, Part B deductible, and they will charge you the copay. But as far as the Part B excess charges, like literally maybe a handful of people that I've spoken with had actually been charged. And remember this, since 98% of doctors accept Medicare, and you can do Medicare with a supplement plan, if your doctor wants to charge you the excess charge, okay, and by the way, you do have every right in the world when you go into a doctor's office to say, are you going to charge me excess charges? Okay, and they have to tell you yes or no. But since there's so many doctors out there, okay, and if the guy's going to charge you an excess charge, you're like, oh, you know what, maybe I'll just go find somebody else. All right, so keep that in mind. So those are the major differences between the Plan F, the Plan G, and the Plan N. The Plan F, 100% coverage for everything, but they are a little more costly. Just like insurance products, the more you get, the more it's going to cost, okay? The Plan G is the one that we recommend the most, only because you only have the one deductible. This year's $198. That's the Part B deductible. And then the Plan N, you have to pay the same Part B deductible, you have the co-pays, and you have the excess charges. So that's the difference between the Plan F, the Plan G, and the Plan N. This just telling us that the newly eligible beneficiaries of Medicare as of January 1st of 2020 cannot get the Part B, cannot get a Plan F. Part of the reasoning for this is because if you had a Plan F, a lot of people decide that, no, you know what, I got a little sniffle, let me just go to the doctor. So what happens is that Medicare thinks that they can save money if people now, if they turn around and say, wait a minute, I got to pay the $198 deductible. So, you know what, maybe I'll just go to the next, I'll wait till I get a little sicker, then I'll go to the doctor. So a lot of unnecessary visits will be done by seniors going to the, doctors if they knew they didn't have to pay anything. So this is the reasoning behind the eligibility of a Plan F after this January 1st of this year. Okay, Medigap open enrollment periods. As I was telling you guys before, okay, you have that 6-month open enrollment period, okay, where the 6 months after the first, after your Part B becomes effective. So if your Part B becomes effective on June 1st, you have a 6-month open enrollment period that you can get any kind of plan, whatever plan you want, at no questions asked. It's your open enrollment, and you're going to go in automatically. So it's automatically auto enrollment, no questions, nothing. If you go in past the 1 day, past the 6 months, so it's 1 day more, 6 months and 1 day. Again, they're going to ask you questions. How's your health? How's your any lung issues, any heart issues, any mental issues, all kinds of stuff, and you can be denied. Okay, so this is one of the things that we say. This is one of the things that this is the third mistake, but this is the things that it's critical to do right away. Okay, now for those people that are on disability, okay, you may be eligible for open enrollment. First of all, if you're on disability but you're under the age of 65 and you get your Medicare after the 2 years of your waiting period, you can get a plan, a Medicare supplement plan. In New Jersey, it's now, I believe it's the Plan D. It used to be the C. They switched it over to a Plan D. We can look it up. It's a little more expensive than a Plan G, but you'll have coverage. Okay. Again, if your spouse's employer or your employer is over 100, then you can keep the group plan if you want. Do not get the Part B. It's critical. Now, at age 65, if you have A and B, and you do have a supplement plan or an advantage plan, whatever it is, at age 65, you have another 6-month open enrollment period. Once you turn age 65, from that month, you have another open enrollment period in order for you to pick another product. Okay, so in New Jersey, if it's Plan D that you have to get, it's a little more expensive. You can switch to a GRNN at that point and have a less of a cost with those plans. Okay. Okay. There are guaranteed issue plans that you can get, or not guaranteed issue plans, but if something happens, whatever scenario is, if you're in group, you have an original a Medicare or an employer group health plan, and a union coverage, and the plan is ending, you have a 63-day window in order to get it. If you move from a Medicare Advantage plan, you have a 60-day window in order to get a plan. If you try a Medicare Advantage plan and you don't like it and it's past your 6 month, you can turn around. You have a 63-day window to say, listen, you want to try the other plan. You can get the Medicare supplement plan at that point, and no questions asked. It's guaranteed issue. Anybody prior to January 1st of 2020 will be guaranteed issue as a Plan F. Anybody after January 1st of 2020, the guaranteed issue is a Plan G. Okay. If you tried a Medigap policy and you decided to go to an Advantage plan, and now the Advantage plan, you didn't like the Advantage plan, you want to go back to a Medicare supplement plan, again, you have a 63-day window, and again, guaranteed issues, either the high deductible or the F or the G. Okay. If you your Medigap company or Advantage plan, goes under, and they're no longer covering you. And this is the reason why we suggest you go with an A-rated company. Again, the Aetnas, the Cignas, the Mutual of Omaha's. If something happens to the company that you choose, again, you have a 63-day window. Okay. The bottom one I can't really see, but it says if you leave a Medicare Advantage plan or you drop a Medigap policy, okay, within the first year, if you don't like it, you have the safeguard of a 63-day window in order to get a plan. Once I see something that you do not see down there, but it's this, and this is very important. If you turn 65 and you decide to retire, but you say, you know what, I'm going to take the Cobra plan instead of going on Medicare, okay? Well, here's a problem. Medicare is your primary. Cobra is not. So if you go into a hospital or anything, and then you tell them, your mindset is, well, this is my previous coverage, but now it's Cobra, and that's pre-65, then that's fine. That's the right mentality. But once you're Medicare eligible, Cobra takes a different meaning now. If you're 65 and you go into and you keep the Cobra, Medicare is primary. Okay, so this is called the Cobra trap. You go into the hospital and all of a sudden, well, I have my Cobra coverage, and they can turn around and say, no, you don't have. You have Cobra coverage, but Cobra is secondary. You have to send Medicare, your plan first. They'll cover, and then Cobra will pick up the balance. So be careful with that, folks. Cobra, it's called the Cobra trap, and most people don't know about that. Okay. Now we're going to get into the fun stuff. This is the RX plans. Okay. Please hold any questions for the end as far as the Medicare supplement, Advantage plans, or Medicare original Medicare A and B, whatever it is. Okay. Again, you can call me, and I'll discuss these issues with you at any time. Probably better off calling. It'll be more of an individualized thing for you, and it'll be more in depth. Now, the Part D prescription coverage, okay, of Medicare. Okay, there are certain guidelines that the government puts on these plans, and they have to go by it. Okay, and this is where the so-called donut hole comes in. One of the things that they tell you to do, okay, and by the way, it's very, very critical to get the correct plan, all right, for you, because it is very individualized, okay. But looking at what the Part D prescription coverage does, okay, one of the things that the government mandates is that a plan, if the plan wants to charge a deductible, it cannot be more than $435. This is for 2020. So the deductible of the medication cannot be $435. Now, the deductible only applies to tier 3, 4, and 5 medications. Tier 1 and 2 there's no deductible involved with those, so you don't have to worry about that. All of the higher end medications, the tier 3, 4, and 5, that's when the deductible comes into play. Okay. Once during your deductible period, if you have a tier 3 medication, then you're going to pay the $435 deductible, and then it'll lose. Once that's paid, your monthly premium, or your monthly cost, not the premium, excuse me, your monthly cost will go down. Okay. Now, during the initial coverage, getting into the donut hole, all right, what the government mandates is that the total cost, the total retail cost of all your medications, once it reaches $4,020, so if you have 4 different medications, the total retail cost of all those 4 medications, if let's say it's $1,000 a month for the total retail cost, not that you're paying $1,000 a month for these meds, you're paying whatever the plan is actually charging you for the plan. But the retail cost of them is $1,000. Once you hit $4,020, okay, like in step 2, now you're going from the initial coverage into what's called the coverage gap, or most people know it as the donut hole. Okay, so once again, once your total retail cost of all your medications reaches $4,020, now you hit the donut hole. It's confusing. Not gonna lie to you. There are times when I got to look at it and go, and I'm still a little confused by it. Okay, but what happens is that during the donut hole coverage, 6,300. Once you between the $4,020 and the $6,350, okay, which is called a troop, or your true out-of-pocket expense. Okay, once you reach that troop, the 6,350, that's when you come out of the donut hole. Now, to show you what the donut hole is, once you're in the donut hole, okay, what happens is the pharmaceutical, it's not like you're going to spend $6,350, okay? There's formulas involved. The insurance company is going to pay a certain amount of money. The pharmaceutical company is going to pay a certain amount of money. You're going to pay a certain amount of money. Once those three factors come into play and you get to that $6,350, that's when you're out of the donut hole, okay? But in the meantime, when you're in the donut hole, if you have a brand name drug or a generic drug this year, you're going to spend 25% of that drug. So all of a sudden, you're going to the pharmacy and you're picking up some sort of inhaler or something like that, and they've been charging you $20. It's a $400 medication. They've been charging you $20 during the initial coverage phase, and now you go in and the pharmacist says, well, it's $100 this month. Well, yeah, it's 25% of $400 for that, what that medication costs. Okay, so yeah, you will spend more money when you're in a donut hole. Okay, and that's how it works. Again, once whatever the insurance company pays, whatever the pharmaceutical company pays for that particular medication, and whatever you're going to pay for that particular medication, once it reaches the $6,350 level, now you're out of the donut hole and you're what's called into catastrophic coverage. At that point in time, you're paying either 5% of the medication, so the medication cost drops considerably at that point, okay? And either 5% of the medication, or $8.95 for a brand name drug, or $5.95 for a generic medication. Okay, so it does drop dramatically. Now, as I said before, going into the initial coverage and coming out of the coverage, is not like you're spending $4,000 out of pocket or $6,300 out of pocket. No, it's about $2,000 out of pocket to get in and about $2,000 out of pocket to get out. Okay, so it's not like you're going to be getting it. Again, most of the people don't reach. It's about maybe 12 to 15% of the people actually hit the donut hole, okay, depending on the medications. And it's maybe about 10% of those people come out of the donut hole, okay? They generally hit the donut hole sometime later in the year, depending on your medication. So that's where it gets a little confusing for most folks. But just think of that. To get in, you're going to spend about $2,000 in your meds, and to get out is about $2,000 in your meds. If you do get out and hit catastrophic, then it greatly reduces your plan. But again, 15% of people, get into it, so it's really not a lot. Now, as you can see, this is the number 2 mistake that people make. I told you I didn't forget about that. The number 2 mistake that people make is not analyzing your RX plan correctly. I have a formula. There's actually Medicare.gov has a formula which I use, and it tells you according to your medication, because remember, this is in particular, it's individualized to you. So however you have that medication cost, whatever that medication's cost is, that's how Medicare.gov, what it does is it takes all your medications, sees what the total cost is, and picks the best plan that's going to be the least expensive of all the plans first. And it's going to take 3 things into consideration: the monthly premium, the cost of the medication, and any deductibles involved with that. It's going to take those 3 figures, it's going to combine them, it's going to see which is the least expensive plan on the market, and then it's going to recommend that plan for you, okay? Just to give you an idea real quick, a gentleman came in one day and he was looking at a plan. He says he had his buddy's plan, he wants his buddy's $35 plan. So we're like, wait a minute, let's look at your meds. So we looked at his meds. This is an actual case. We looked at all his medications. This is the actual medications this gentleman had, okay? And we told him his buddy's plan didn't work for him. His plan was a $98.30 plan, had no annual deductible, but it had a cost of $4,796. Okay, he's like, that's crazy. I don't want to spend. I don't want a $98. I want the $35 plan. His buddy's just $39. I'm sorry, the $39 plan. If you look, his total annual cost would have cost him almost $12,800. That's what would have cost him. Why? Because the 3 medications that are on there were not in the plan itself. They are not covered by the plan. So for the 12 months or whatever period of time, the 12 months, he was going to have to pay for those medications. So this is what I mean, that this is very critical for you to pick the correct plan, okay? And just to show him that it has nothing to do with the pricing on the plan, we picked another $97 premium plan, which is close to the plan that we had recommended to him. Another medication went off that it wasn't covered under that plan. His annual cost would have been over $16,000. So that's why we mean it's very critical to do that. So just to reiterate with this, the Card A that we recommended for him was a $98 card, but his total annual cost would have been $4,800. The Card B, which is his buddy's plan, who his buddy swore by it, would have cost him $12,600 for the whole year. And if he just to show him that it had nothing to do with the premium, there was a $97 plan that would have cost him over $16,000. By the way, you do need to do that every single year. That's something that you really should look at every single year. Folks, we're done with this. Let me just give you the rundown of what we just spoke about. Number 1 mistake, not enrolling in your Part B on time, enrolling during your initial enrollment period. You can get that 10% penalty on a yearly basis. COBRA, TRAP, be careful with that. After 65, you're eligible. COBRA is not primary, it's secondary. Retiree plans, you will be Medicare, it will be the primary at that point, okay? Social Security disability, if you're on Social Security, the disability, you can get a Medicare supplement plan the first 6 months of when you're eligible for the Part B, and at age 65, you can get it again. You have another 6-month window. 2, the number 2 mistake, not analyzing your prescription drug plan. As you saw in the previous slides, could cost you thousands and thousands of dollars in order to do it, okay? The formulary is key through Medicare.gov, and you do have to do this every single year between the annual enrollment of October 15th to December 7th, and the reasoning is your meds might not change, but the plans do change every single year, so we should reevaluate every single year for your medications, because the plans change, and all of a sudden you go from a couple of $100 for the year to a couple of thousand. So we definitely have to check that. Number 3, again, choosing the right product. Do you want a Medicare Advantage versus a Medigap? Networks versus referrals, which is an advantage. Your maximum out-of-pocket expense, again, an advantage. Changing during annual enrollment, you have to check that. Whatever extra benefits that you might have. Overall expense is something that you should definitely look at. Even though you have a monthly premium with a Medigap plan, it's still going to be a lot cheaper than if you were to, hit a doctor bill for, that $6,700 out-of-pocket expense. Okay, and remember, this is one thing that you're going to get for the rest of your life. So choose correctly. Okay, talk to a professional. Number 4, not analyzing your retiree coverage. You have to be very careful with that. Some places might charge you, might not charge you. Okay, it all depends what that is. And then number 5, listening to friends and family. That's the number 5 mistake that people make. Okay, remember, it's an individualized plan, especially the drug card. It's what's good for you might not be good for the next guy or the third guy. It's a very individualized plan. Okay, don't get fooled with advertisements. All right, forget about those advertisements on TV. Don't get fooled by that stuff. Analyze your entire expense, not just your monthly premiums, and make sure, see what's guaranteed renewable, what's not guaranteed renewable, things like that. All right, folks. So with that, this does conclude. I thank you very much. This just tells me, this actually is just that you know that your current card had or your old card actually had your Social Security number on it. Now you do have a different individual Medicare claim number on it, and no Social Security number any longer. And here's my information again. Anybody need any questions or anything, please feel free to give me a call. or email me, whatever the case is.
Thank you for joining us for this week's Encore presentation. To join us for live programs or to learn more about the East Brunswick Public Library, visit our website at ebpl.org.